so that if you miss this session or if you have to jump away early, you can request a complete recording of the session after we're all done. So we'll post that as well on our website. We'll post it, and it'll be available for anyone. The title of this is "You're Not Alone: Using Text to Help Individuals in Crisis." My name is Jonathan Hawley. I'm with Educational Message Services and Prevention Pays Text. And we are members and supporters of the AIRS network, National Suicide Prevention Lifeline, Contact USA networks, the services that are the common denominator of all of these agencies that support the text line communications all adhere to CTIA and FCC communication guidelines. That just means that they allow people to opt in and opt out. People know that they're in user privacy protected numbers that they're texting with. We're going to start with a little bit of a background or some facts on texting and how texting has evolved rapidly, as I'm sure you are all very aware. So texting trends. 83% of adults, and these are from Pew Research, these stats, 83% of American adults own cell phones, and 3/4 of them, 73%, send and receive text messages on a daily basis. Americans under 55 text more than they talk on the phone and email combined. Over 70% of Americans would prefer to text over phone for live help, so if given the option. However, there just isn't the infrastructure to support it at this time. But many agencies that are experimenting with text are now finding that there's a whole cohort of Americans that would actually prefer to get some live support through text. Over 98% of texts are open in the first 5 minutes. So amazing read rates. To give you an example, by contrast, 80% of all tweets get ignored. So if you're a Twitter or Facebook, you know that the feeds that people share, and on Twitter, 80% you by default ignore 80% of all the tweets that come through your feed. Whereas text, you get a 98% read rate. So people are locked in. 80% of all web browsing in the United States is happening on smartphones. 80%. So that's why we have things like the data plans, and that being the source of revenue for carriers, because people are going home, and rather than browsing the internet on a computer or laptop, they're browsing the internet on their phones. That's why web neutrality has become such a big issue as well. People watch videos, they do a lot of streaming, and there's a lot of support for parity to continue to allow those services to be available to everybody at in an open and in an open manner, and not allow certain companies like Netflix to charge more for particular higher speeds. And so it's a very interesting topic, but it's become a major topic in the United States. I'm sure you're all aware of it. Individuals prefer text when dealing with sensitive subject matter. So this now is research. It's supported by research out of the University of Minnesota, University of Michigan, Cal Berkeley. And if you have any interest in those research projects, you can contact us and we'll send you the complete evaluations and research projects. But individuals, when dealing with sensitive subjects, actually would prefer to use text. There's a sense of privacy, elevated privacy that they feel that they get with text. Exploring text messaging in crisis. So that's what we're going to dig into, and we're going to dig in with partners. We're going to dig in with panelists. And the subjects that are this session is loosely based on is warm texting, the concept of it, and then repeat texters. What does that mean? And then there'll be discussion, and the panelists will be able to comment on what each other are sharing. Okay, this first case study is by Crisis Support Services text line in Alameda County, and the panelist is Karen Oberdorfer. She's LMFT Text Line Coordinator for Crisis Support Services of Alameda County. Excuse me. Karen, I would like to introduce you to the team, or I'm sorry, to the audience. And Karen, can we hear you? Okay.
Yes.
Thank you so much.
Hi.
Okay.
Thank you. Hi, everybody. It's exciting to be meeting all of you virtually. Yeah, so we started, Crisis Support Services has been around since the mid-60s. Started off as a crisis line where we had volunteers for the community start to answer crisis line calls, suicide prevention, orientation, and it's grown over the years to have lots of different departments, including one department closely associated with the text line, and that department does outreach to the community and does suicide prevention outreaches and lets the community know about our text line. And the actual text line department is within our crisis line department, and that started in 2011, and largely because we were finding that youth and young adults, adolescents were not calling our crisis line. So the main impetus behind starting the text line was to outreach specifically to youth and young adults. So we get the word out through presentations by our community ed department into middle school and high school in Alameda County. So yeah, I've been doing this the whole time at Crisis Support and really learning a lot along the way. One of the things that we found is that a lot of youth were texting in about non-suicidal self-injury. So I ended up researching that a bit, and we co-presented in 2015 at the American Association of Suicidology conference on text crisis counseling with youth who present with NSSI. Yeah, so I've been around a long time in the Bay Area and love it here. So yeah, go ahead, Jonathan, we can switch to the next slide. So as I was saying, we outreach to youth in Alameda County. So it's kind of it's hard for us to get the word out in terms of doing it on social media, and because we really are funded specifically to work with Alameda County. So the majority of our outreaches are in schools, as I had already mentioned. And we were worried about being overloaded with too many texts the first few years. So we really kept it to just a few schools, something like 20, I think, that first year. And then we realized that we would not get bombarded with text sessions. And so now all of the community education presentations in the schools receive our text line information in Alameda County. So that's about 30 schools. It's a good 10,000 students a year, if not more. And as you can see, we get anywhere from 1 text a night to 5 texts. And our average text session is about an hour and a half. Yeah, go ahead, Jonathan. We can switch to the next slide. Thanks. So we were expecting, that we would get texts where people would talk about, being ready to act on their suicidal ideation, high level of crisis. And what we found actually is the exact opposite. We measure our distress level and our suicide levels on a scale of 0 to 5. We have 2 levels of measurements. So the distress level is 1, and the suicidal ideation level is a second measurement. And from 0 to 5, where 0 is not at all and 5 is either highly distressed, or 5 in the suicidal ideation rating is they've already enacted something to die by suicide. Most of our levels of suicidal ideation are anywhere from 0 to 3, really hovering around a 1. We use Thomas Joyner's way of, as an inspiration to how we measure suicidal ideation. If suicide is not specifically mentioned, but yet the texter is feeling helpless and hopeless and like a burden to others, then we might rate it as a 1. So most of our suicidal ideation ratings are around 1 or 2. although it's been growing recently since 2016. Um, and there may be some correlation with the political environment, but also I think we are having some more young adults texting in, and we're also partnering with some of our local psychiatric hospitals, and they're displaying our text line information along with our crisis line information. Go ahead, Jonathan.
Mm-hmm.
So training, we initially hired me just as somebody who would interface with Jonathan and EMS. And so I was part-time and just, going to be training everybody on the technology, because we have a quite robust training program for our crisis line counselors already. And really shortly thereafter, we realized it's a similar animal, but it's a slightly different animal. And one of the things is really being deliberate about active listening techniques on text is needed. Also, sort of being sensitive to how tone can get transmitted through text and how to read tone of our texters. Some of our tools are, again, to use a lot of active listening, open-ended questions, unless we're doing a suicide assessment or harm assessment on non-suicidal self-injury. The use of very simple emoticons, and because we're texting with younger people, we take a slightly, I wouldn't say casual or flippant, but a little less formal and clinical tone seems to really aid in the ability to have our texters feel comfortable and build rapport in order to open up and also answer our assessment questions honestly. We try to assess for suicide every single time, even if it's not within the content of the session. And sometimes we have to do damage control. Somebody might say, no, I would never do that. Why do you ask? And so we just talk about how sometimes people have thoughts of suicide even when they're on the outside seem to be doing okay. Yeah, go ahead, Jonathan. So we're finding that some of our text sessions will seem like a warm call. They're, maybe texting in about a fight they had with a friend, but they're not that upset about it. Oftentimes with our younger texters, we find that it might take 1 or 2 sessions before they feel a sense of comfort with our service in order to talk about some of the maybe deeper issues that they're dealing with, whether it's family dynamics or using non-suicidal self-injury to cope, or maybe having thoughts of suicide on a regular basis, or feeling like they might be clinically depressed. We also sometimes interact with people who go in and out of psych hospitalizations, and in between their hospitalizations, they may just need a place to check in. And even though they're not presenting with something on the level of what people might consider a crisis, could just be checking in for the day, or they had a scary thought. It's a really helpful service just to help them stay grounded and to help them measure whether or not they're doing okay or whether they need to go back to the hospital. And then additionally, first-time texters, they may just be wanting to check it out. We've had a few people sort of present with some pretty extraordinary stories that probably were not real. But we were friendly, and we didn't come down heavy like Big Brother and say, this is, you're taking time away from other people. We were just, kept it short, but let them know, hey, if you ever have anything you really want to talk about, we're always here. Yeah, I think that's it. Go ahead, Jonathan. Yeah, here are some, some quotes that we've had at the end of some of our sessions. I feel much better. Thanks for everything you've done. I'm not feeling suicidal anymore. Thank you so much for all your help. Yeah. So.
All right. Is that your last slide, Karen?
I think so.
Okay.
I think it might be.
Okay, so we wanted, thank you so much, by the way, and also just to footnote, you know, when you talked about people experimenting or testing it out, sometimes those actually turn into real needs, right? Sometimes those evolve
Absolutely.
into, yeah.
Yeah, absolutely. Oh, and by the way, I just want to let everybody know, if you all ever want to talk about anything related to text, I can talk about it for hours. Feel free to email me.
Oregon, Lines for Life, Emily. Oregon.
Hello. Hi.
Anything to add to the thoughts there?
I don't think so. We were actually kind of, as we were listening, really, we do a lot of things very, very similarly. And Karen, lovely presentation throughout that.
Thank you.
Yeah, your training looks super similar to ours, and definitely it was a very thorough description. So thank you.
We also share the same sort of passion for this work as it relates to texting. And I want to just emphasize, this is Emily, by the way, that that being said, is that I do believe that has something to do with how, if you are a crisis center, how you would approach it in general. We believe that our text contacts are as important as the other online emotional support we give via email and or chat, as well as our phone calls. So they're just different platforms, is the best way to put it. We don't believe that one is better than the other, or that one it can be more or less successful than the other one.
Thank you so much. And we're going to segue to yours in a moment. I just wanted to see if Minnesota had anything to say or add to Karen's presentation. Lori, you there?
Thank you. I am. Thank you very much, Karen. That was very well said, and I truly appreciate it. With our experience here, we've been texting.
Thank you.
Since 2011, and we have some very similar things going on. I really want to emphasize the growth in this technology at the time and over these past years. We have been a NSPL center, since the beginning, and currently looking at our volume, our text program is about 1/3 of our volume right now, and the cross training that happens for text response and voice response is extremely helpful. And we do find there are some infrequent occasions where the skill set doesn't match well. A lot of the skills cross over, and I want all of our staff cross-trained. However, there are some folks that are much better at the voice service, if you will, rather than the texting service. And there are some people that just really excel at the skill of texting, as what you talked about, putting these little ums and ahs and things in text so that can flow, that conversation can flow. Whereas maybe they're a little anxious on a call because they haven't done that as much, so tone comes through. There are just some small differences in there that we've kind of learned to appreciate, and across the board, our training services and responses just have been so helpful to grow this service across the country. Really, we get folks from everywhere. So I agree with what you have said. Thank you so much for saying it so well.
And thank you so much. It was a wonderful comment, Laura, and feedback. You're exactly right. There's sort of this role that gets carved out at agencies that we've seen now, not just with crisis, but with, INR, information and referral, or we work with a lot of WIC agencies that do peer counseling and help young women. And sometimes those conversations that they have move into emotional crisis, interestingly enough. But the what we see is that there are people who just have a knack for it, that just have, it's almost a calling, and they really take to it. And then others that just would rather stay away from it. So really interesting point to make.
And if I could add to that, for a second, our experience over the years has been that if someone is texting in for help or even connection, they really don't want to have a call service. They don't want that connection. They want to be texting. So to ask them to call a crisis line or call a number, most of the time they weren't going to do it. However, we have been able to use both services in tandem in some of those high-risk situations where maybe someone drops off on the texting and we are concerned and we need to find out if they're okay and want to touch base. We'll then engage our phone services to call them and touch base, say we're really concerned. We're calling because we weren't getting a response on our text conversation. And so that's been really helpful to have different venues.
Yeah,
sure.
Definitely.
And cross-channel is definitely something that we see more and more of, whatever it takes to get through and whatever it takes to keep them, going towards that de-escalation, moving away from their crisis or their emotional distress. So absolutely. I want to introduce formally, because I don't want to skip past the introduction of these people, these great people who have been doing this great work for so long. In Oregon, there's Lines for Life, and they have been around, they'll tell you, they've been around for quite some time. And the individuals who are going to be sharing about their tech services are Emily Mosier, MFA, MAT, Assistant Director, Youth Line Program, and then Morgan Leitz, MED, Youth Line Coordinator. Both are, and I had a wonderful meeting, by the way, and maybe you'll touch on that a tiny bit, Emily, just the fact that you guys came down here and are doing so much networking and so much work in your field that goes beyond just managing services and public facing. I mean, it goes into just really kind of self-improvement type work that makes you guys better at what you do. So maybe you want to share a little bit about some of those adventures you've had recently and going to conferences and so forth. Please, I'm so pleased to welcome Emily and Morgan, and let's go ahead and begin. And would you guys like me to flip to your first slide, or you want to start with just this slide showing?
Actually, thank you, Jonathan. That was a very nice introduction. This is Emily, and we can stick right here for just a second. So I can explain a little bit about Lines for Life in general. Lines for Life is a nonprofit. Our mission is to prevent substance abuse and suicide, and we do that in 3 different areas of work. One is around policy and advocacy. The second is around prevention education, primarily with the focus right now on opiate and heroin use and prevention around those issues. And then lastly, where Morgan and I work in the area of crisis intervention. Our crisis intervention is all via phone, text, chat, and email. So we use online emotional support primarily with texting, but we have a variety of different platforms. So like was so nicely said earlier by Laura, that we want to meet people where they are. And we have a lot of people that like to communicate with us via text. Our organization has been around for over 25 years, and we have been texting on several different platforms for the between the last 5 and 6 years. So a broad overview of that work, and then just so you know, we're going to primarily focus in on our youth line and our teen-to-teen, peer-to-peer work, just mostly because that's where Morgan and I work, and also because that's where we have the most data. So the next slide would be great. So we have an alcohol and drug helpline where we primarily use text to help with resources and resource referral. And then we also have a military helpline that is, as you can see, that this is primarily because of our outreach and our efforts in outreach. It's been around for quite some time, but a small texting volume as it stands. However, when you look at the caller issues on this slide, you'll see that that the reasons why people call, or the reasons why people text us, are pretty serious. Jonathan, you could move on. Next slide, if you wouldn't mind. And then with our Suicide Prevention Lifeline, so we are an affiliate of the Suicide Prevention 273 Talk, which is the texting line for the Suicide Prevention Lifeline. And in that, at our agency here in Oregon. So on that line again, the texter issues you can see at the top of the list, which quite frankly isn't surprising because it is a suicide hotline. Suicide is at the top of the list. And then our next slide tells you a little bit more about the youth line. And you can see that the call or the text volume is quite higher, and has been growing over the last 5 years, has grown exponentially. I like to say infinity plus one when I talk about how quickly our volume has grown. There's a clear need amongst young people to have a platform that they feel comfortable on. Interesting, when you look at the caller issue data here, that you see that suicide is not at the top of the list, but it certainly still falls within the top 5 and is a considerable amount of people. The youth line is definitely a crisis support and hotline and helpline. We like to look at it from 2 different perspectives. One is that we are there for sure to de-escalate crisis and to connect to resources as needed. In addition to that, we do deal with, and Karen, I think, discussed this to a certain extent as well, that we deal with people that are also struggling with mental illness or with young adults and teenagers. They're dealing with stress and anxiety around family issues, relationship issues, friend issues. And what we see in those categories is an opportunity to use all of the same skills that you use when you're talking to somebody around active listening, to get a better understanding as to what is actually really going on for them at that moment in time, and then working towards resolving those issues over the course of the time that we spend with them on the phone. So I'm going to go to the next slide, and then we'll talk a little bit more detail about kind of what that looks like. This is just an outline showing you, or the pie graph obviously shows you like how everything shakes down on our lines. With our training around online emotional support and texting, we also train in and around these areas as well. So there is some background information for the people that are on the text around what texting looks like and how you communicate via text, but also some framework around the different issues that our texters may be asking us about, or maybe discussing with us. So I'm going to let Morgan talk a little bit more now about some of the issues associated and I guess some of the variables specifically related to the texting conversations.
So one of the things that was already mentioned, and Emily mentioned it again, was this idea of talking to folks maybe about things that don't necessarily seem like in this moment maybe an imminent risk crisis. So maybe it is a family issue, maybe it's a breakup or a fight with a friend or something along those lines. And this kind of goes back to that idea of this warm texting that was mentioned on the very first slide. And for us, part of what is really, really important to us is that we are creating a space where we can meet folks where they are. So no matter what it is that they're struggling with, we're able to offer them support. And the hope is that if we're able to meet somebody today when maybe they're having a fight with a parent, or maybe they don't know how to communicate with a teacher that they're struggling in their class, or whatever it happens to be. And this is very specific on our youth line, that we can help them hopefully to work through those emotions, but also to work on some skills or some strategies to be able to communicate their feelings or to be able to talk to somebody. And the hope is that we are doing something that kind of the term we use is upstream prevention. Because if we can help someone learn today those skills, or work through those skills of how to be able to have a conversation or deal with a really stressful day, or know when to reach out, then, a week down the line, a month down the line, maybe a year, they have the skills when maybe something a little tougher comes up for them, or when they're having a little bit harder time. So that is why we do identify ourselves as the help, support, and crisis line, is because we will talk to you no matter where you are, whether you're in that upstream place where maybe it's just a fight today, all the way up to and including folks who are actively suicidal while they're talking to us. So a little bit about kind of where we recruit our folks for the youth line. We recruit youth from the Portland metro area, and then for our other crisis lines, we have all of our adult crisis line staff are trained to answer those, and then volunteers who have showed interest in being online emotional support trained. So what that training looks like is very, very similar to what Karen mentioned. Just a couple things that want to throw in. Karen mentioned this idea of using emoticons, and those can be really, really helpful when talking to young folks. Because it does, as she said, kind of lighten the mood a little bit, or helps them to feel a little bit more comfortable in sharing. We've also noticed, as we talk to folks on the military line, or on the alcohol and drug help line, or the suicide prevention line, that sometimes matching their language really helps. So not necessarily using emoticons unless they do, but maybe if there's certain terms that they're using, if they're using kind of that idea of text speak, so the letter R, U, okay, versus spelling those things out. If we're able to match their tone, it also helps them to feel a little bit more comfortable in sharing, and feel a little bit more of a connection that sometimes we lose because we don't have the vocal tone of the person as we would on a phone call. And so texting itself, we have found, has its own tone. Folks have their own kind of words that they use, and it is really cool kind of as you get into this work, being able to recognize that and connect with people in a way that sometimes when folks first start getting to working with this, it feels a little kind of nerve-wracking that you lose that. But we have found that you don't necessarily lose it, it just looks a little bit different. We also, as part of our conversation, include this idea of check-ins and goodbyes, because sometimes, particularly via text, a person may just stop responding because maybe they had to go eat dinner or take a shower or something, soccer practice or whatever it happens to be, which can be a little bit nerve-wracking for the staff member. And so, or for the crisis worker, I apologize. And so we have kind of set times at which we check in with a person to see how they're doing. And then we always, whether or not they get back to us, say goodbye to them in kind of a way that says, we care about you, we want you to take care, please do reach out again. So that someone knows, even if they, kind of disappeared in the conversation, that they're able to come back and talk to us again in the future. Of course, if there's risk involved, there's going to be a little bit of a different a different process in that to decide whether or not we need to take extra steps. And so one of the questions that was kind of posed is, does the assist model work via text? And I would say most definitely yes. And so we use not only the assist model and the safety framework through that, but also on for our risk assessment in our agency, we use the Columbia Suicide Severity Scale rating to just see kind of what needs to be done and what are the steps that need to be taken to ensure that we have a safety plan that is going to work for the person and help them to be safe in the night if they are reaching out in kind of that higher risk place. So one of the things that has been really cool for me is kind of seeing the feedback that folks share with us after following a text. So Karen's were fantastic. And we actually had a young person who kind of one of the coolest messages I've ever seen following a pretty lengthy back and forth conversation because we had talked to her over, I think, a month, to offer her support, because we do offer follow-up. So after a conversation, we can offer a check-in the next day. But we had talked to her for a little while. But her one of her last messages to us was, if you weren't here, neither would I be here. And it was just really, really cool to see that she was able to get the support that she needed, kind of where she was. So, so yeah. And then I think the last thing we were hoping to chat about is repeat texters. So folks who reach out to us pretty consistently. And so one of the things that we are hoping for when talking to anybody is that folks know kind of the limit of our role. So we cannot be, unfortunately, long-term mental health care. We aren't really able to necessarily just kind of chat with folks often. But if we're able to let them know, I'm here to offer you support in this moment. I'm here to help you through and give you the support you need and kind of help you maybe to find some ideas for next steps, then they know where we're coming from. And we can say, when they start kind of reaching out and maybe are looking for a longer term care, we can let them know that that's not really our role, and we really, really want to help them find that right care and the best support for them and whatever that looks like. So, while we do offer those follow-ups so we can stick with somebody as long as they need us, there are times that then maybe there's a better option out there, or kind of more in-depth or kind of a higher level of care that would be helpful for them. And so we will work with them to provide those appropriate ideas for support and the appropriate referrals, and help kind of work with them to talk through how they might link to those referrals. Emily, anything else?
I think in terms of just across the board, one of the things that is interesting and important to note from the perspective of our work is that we have these sort of niche lines with the military helpline, the alcohol and drug helpline, the suicide line, and the youth line. And the reality is that how we manage a text and how we train to manage texts is the same across all those lines. It can definitely look different because you're dealing with a target or a niche population. And so when you're going back to sort of the nuancing of texting, it has to do with military culture or youth culture or questions associated with A&D. So, and it's just something to keep in mind that the framework is really the same no matter who you're talking to. You adjust based on the culture, and then maybe some of the other training that your volunteers or your crisis workers get is around very specific issues associated with your texters. But it works, and it works with any of those populations, which I think is hopeful for all of us.
You mentioned something, common thread with all of these crisis and hotlines and helplines that we work with is training, just really thorough, extensive, thoughtful, and following sets of protocols, and really having that written down and available and used in a way that has, you're measuring the outcomes of that. And I was just wondering, with your guys and the peer counseling work that you do and training youth, is that difficult at times, meeting the rigorous training and knowing that you're just going to be working with some of them for a short time? And can you share a little bit about that?
Certainly. So we request a 1-year commitment from our volunteers. And we've actually found that our young folks they will stay with us as long as they are able to. So, most folks kind of move on to new adventures in different places following graduation. So typically after graduation, we don't have a lot of folks who stay just because they move out of the Portland metro area, but our young folks tend to stick with us kind of for as long as they're able to until they move. And we have found that our young folks respond really, really well, not only to the 50-hour training they get anyway, but also to this online emotional support. And I think it's because young folks they connect via text, I think, in a different way than maybe folks just from different generations, because this has been part of their world, for as long as they have had access to technology. And so they tend to really appreciate that connection and really enjoy using kind of this mode of communication.
Yeah. I'm sure you get some that go, well, I've been texting forever and, I can just jump right in. But you guys have this rigorous training that, they all must go through, which I think is just excellent. It's just a real tribute to the work that you guys do. People don't realize that it's not just about putting bodies on a phone service or a text service. There's some real
important point.
Yep.
Well, and I mentioned specifically the youth, but I would say also our adult staff and volunteers do really, really well with it. I think for some folks, there's a little bit of a nervousness in the beginning, again, about losing that lack of vocal tone. But typically after using it for a while, I think folks get, comfortable with it. And it's just another way to meet a person who's in crisis and needing support tonight.
And if I can, this is Laura, if I can also throw in what I've witnessed here, we provide response on site, and the text counselors, unlike phone counselors, have a few minutes, if you will, to think about a response and really focus the response. They are trying to, I so agree, they're trying to match the language used, and it depends on what service they're coming in for, the vernacular they're using, and resources they're going to need. But the counselor's matching the pace of the text conversation as well, as you all know. And it is a little bit of a luxury when someone is engaging in a text conversation and they see the text message come in and they can sit with a coworker next to them and say, okay, let's brainstorm this a little bit. Where do you think we're going with this? And what if I say it this way or that way? It's very helpful to do that versus a phone conversation when someone doesn't have that luxury of taking a little bit of additional time to think about how they want to word something.
Hi, this is Karen. I wanted to echo that. It's been a wonderful training tool for our crisis line staff, even if they're not wanting to do the text line, because it slows down the process. And you have to be really, it gives you a chance, like you were saying, of being really purposeful of like, what is my intention here about saying this? Is it to help them feeling normalized, or is it to do an assessment, or is it because I don't know what to say? Then we have a little moment there to figure out, okay, what's the next step in our process for de-escalation and safety planning, or whatever our goal happens to be.
Right, and I think for just the ease of oversight, when I walk through the text area and I see a couple of bubbles, I can easily say to the counselor, you need to rethink how much you're talking versus how much they're talking. And I don't even need to be in on the conversation to do some reminders about let's let them be the ones saying more. And you have to be careful about how you match that. It's really an interesting source. I also wanted to say, when we're providing, and this is what Morgan was talking about, when we're providing that assessing, and it sounds like we all do the same thing with the CIS and Columbia Suicide Severity Rating Scale and Thomas Joyner's theories of crisis, that's all the same. When we're teaching coping skills to someone texting in of any age, we're modeling conversations they can have with their support system, and we're connecting them with their support system. And what we found helpful is the person that's involved can pull up that conversation on their phone and remind themselves at any time, because they can have a conversation at any time. They don't have to have a conversation when they're alone in a room for confidentiality reasons. They can be sitting on a bus or in a hallway or wherever and pull up that conversation to review it for themselves. And I think that's extremely helpful.
Definitely. Thank you so much, Laura and
That's a good
Karen.
point.
I agree. Like there's so much in how we support. And I think also in the collaboration, our crisis workers are able to offer each other. I think you mentioned, like, you know, being able to take a minute and kind of look over to somebody and say, like, hey, how would you respond to this? Because I think as crisis workers, to be able to have that extra support and know that there's someone there who can kind of help and collaborate if maybe it's a topic that they're not feeling comfortable with, or they're not exactly sure how to handle, and knowing, like, hey, my, you know, co-volunteer, my co-worker maybe has had an experience like this before, or is really good at talking to callers or folks who are dealing with this sort of crisis. Being able to have that extra support and that extra help can be just an amazing comfort, even if you don't necessarily reach out for it. Just knowing that you can really help. We have found our crisis workers and our volunteers to feel very supported and helped in being able to support others in the absolute best way possible.
I think that this is Emily, just to add to that part of our model includes this idea of collaboration and support not just around how you support the callers, but support around how you help each other when some of these phone calls can be really you know, high risk or high crisis. So you have a room of collaborators that are there not only to take the texts, but also to help each other through what could be a highly stressful situation as a crisis line supporter.
Yeah, it's webinars like this too, guys, that kind of bring the voices together and provide an opportunity for learning from each other. You know, that you know, we kind of we're off busy in our regions and doing this work, but it's wonderful to kind of step back for a moment and listen to what others are doing, which leads us to case study number 3. This one is out of Minnesota, and it's Text for Life, and Laura Weber, Masters LMFT, has been speaking and commenting on the prior 2 case studies. She's going to go ahead and lead this 3rd case study. Laura?
Hi, thank you so much, everyone, for being present, and thank you for all the wisdom that we've heard from our providers so far. I really enjoy it. Thank you. Crisis Connection has been a crisis telephone responder, oh gosh, for 46 years or something along those lines. And we started providing text services in 2011, originally from one of the Garrett Lee Smith SAMHSA grants, focusing on youth in grades 7 through 12. So we started in 2011 in a collaborative manner. And from the beginning, we expanded our hours quickly to 24/7 response. And the other component of this program is we have what we call regional coordinators. They're public health educators that are employees of regional mental health providers, and we subcontract with them to provide local education, suicide intervention, prevention, and awareness education in different regions across the state of Minnesota. We currently have 9 regional coordinators that are contracted to us. I think, well, one of them is internally staffed, but the others are contract. And I want to say, in our regional coordinators, we also have a specific breakout of staff. We have 2 tribal coordinators that work specifically with both the Ojibwe and the Dakota nations in the north and south part of the state. We have 11 tribal nations in the state, and so we have specific services for our tribal partners, and with our tribal partners, I should say. Without them, we wouldn't be able to do anything. So I want to make sure and provide that information as well, because we do all work in collaboration. The program was funded in 2013 with tax appropriated dollars. It's contracted through the Department of Human Services at this time. It sounds like we have similar accreditations across the board, so we all work in extremely similar ways, it sounds like. And as I said, the regional coordinators are in schools. We've expanded from a youth focus from the Garrett Lee Smith grant that ended in 2013 to focus also on the Native American population that has an extremely high suicide rate, and adult Caucasian males that also have a high suicide rate. So we really wanted to focus on those areas as well and expand our text services to them and expand our local suicide prevention and awareness services to them. Can you move ahead, Jonathan? So just to give you, we've heard a lot about how we all operate, and as we said, very similar. In 2017, we responded to 11,452 text conversations. That's whole conversations, clearly not specific messages. And you can see over just these 4 years from 2014 to 2017, that's 37,700 plus conversations that we've had. In that, as we've talked previously, there are many what we call familiar texters, and then also many first-time texters. So why we got into this initially is because we needed to find a way to connect with youth. And over the course of our experience, we've found that it's also a valuable way to connect with adults and at-risk populations and anyone out there who wants to get some help. We have, in our text program, we also respond to the Minnesota Problem Gambling Helpline, which we answer the telephone line, and they've expanded. They want to capture some text services also, so we've expanded it to text response as well. We also are contracted to provide services to the University of Minnesota Crisis Line, and they've expanded into the text line as well. So we have different options, and as was said earlier, different resources and different vernacular that are used for different populations, and it's pretty easy to move in between. This platform makes it very easy as well, I would say. Reasons for providing text services in this day and age, I think we need to capture every way that we can so there's a no wrong door policy in getting help for folks in need. 38% of our total text conversations include suicide or self-injurious behavior as the primary issue they're texting in. We average about 11 interventions per month, which there seems to be, the assessment through our processes is imminent danger is present. So we'll find whatever way we can, whether it's texting and they stop responding, we'll make a phone call, try whatever way we can to connect people and stay connected until they get the help they need. And with that, we ask the question about distress levels and where they are when they started versus where they are at different times of the conversation, and if the conversation was helpful. And 93% of all of these texters have said, yes, it is very helpful. And with that, as you've heard earlier, we also capture some of those thank yous. We do use them in our utilization reports, and primarily it is just a wonderful resource to provide back to our counselors who all do very difficult work, to see this posted that these people are saying, thank you, you saved my life. That's absolutely wonderful for staff morale, if nothing else in all of this work that we do. Can you go to the next slide, Jonathan? So another piece that I wanted to touch on in here is that the marketing of the service is essential to growing the service, to the success of having people aware. We have a textforlife.org website. We have all kinds of social media. We have all kinds of marketing materials. I have part of a budget for our marketing department is, just for this piece of work, and it really, really makes a difference to the volume that we have. We cover 54 counties and 11 tribal nations in Minnesota, but our services have been used in all 50 states. We have texters from everywhere, with overall only 55% of our texts coming from inside of Minnesota. We are regional coordinators, as you heard a little earlier. They're dedicated to this Text for Life service. And in 2017 alone, they taught, if you will, over 10,000 people how to access the Text for Life services, the National Suicide Prevention Lifeline, and their local mobile crisis team contact numbers, because we work hand in hand with their local people as well. So we want them to know how to access all of these crisis services and put them right into their phone. So it's not a matter of remembering a phone number. They pull out their phone and they enter this information so that they can just click, if you will, on that resource, and they're connected. We have so many materials that the regional coordinators disseminate. It's over 18,000 just last year. So we do have quite a budget that goes to that portion of our work. And I think that's all I have, unless there are questions or comments.
Thank you. Do you guys have anything to add? Or I'm sorry, Emily or Morgan or Karen?
This is Emily, and I would just like to say a couple of things. Laura, thank you for pointing out the importance of the marketing and the outreach. We do a lot of the same and work towards educating as well as marketing, so people know about our number, but they also know why it's a good reason to call, which I'm sure with your regional outreach that's what you're doing as well. And then I also just wanted to comment on that. I really appreciate the fact that you, when you were talking about your reach in general, that even though all of us work in different states, that texting is universal and is something that, like you, we get texts from all over the United States and sometimes from different places around the world. So it really is a universal connector that opens up a lot of doors, and that you defined them by, which I think is an important distinction, by conversation and not by messaging. So these are actual people that you're talking to, not that the back and forth texting that is occurring. That's a lot of people, and that's why it's important. So thank you.
Yeah, this is Karen. I just want to say thank you to everybody who's presented. It's really wonderful to hear how we all have a similar, I think, place where we come from, and there may be slight differences in basic ways of doing it, but it sounds like we're all very similar in our approaches, and I really enjoyed hearing everybody's presentations.
Yeah, thank you so much, everybody. We're coming up on the hour, and so we're gonna tune out. But we'll have. We don't really have time for questions. However, I'm sure any one of them would be willing to take an email from you guys. Anyone who has a question for any one of the panelists, absolutely. I would imagine they would love to answer. Well, in fact, Karen had mentioned that she would love to hear from anybody who has any questions, and I'm sure everybody else feels the same way. So here's the contact information of all the panelists and their titles.
Thank you, everyone. It was wonderful.
Thank you so much, everybody. Yes, and please feel free to reach out for the recording, as well as to those individuals who shared today. And again, a much appreciation for the work you guys do. It's a real credit to where you are, what you're doing, and how long you've done it. Thanks again.
Thank you, everybody. It's a pleasure working with you.
Agreed.
Yep.
Yes, thank you.